Hello everyone, I'm Jens Salmanton Garcia from the Institute of Translational Research of the University of Cologne, and today I would like to speak to you about our publication Strengthening Fungal Infection Diagnosis and Treatment, an in-depth analysis of capabilities in Honduras. The reason why we started with this publication is that invasive fungal infections are a major cause of morbidity and mortality in low and middle income countries, and that's uh, the situation in Honduras, where invasive fungal infections are underdiagnosed through limited access to advanced diagnostic tools. Specifically about Honduras, it's important to know that it's a country with more than 9 million people living there, with significant rural population and also with major healthcare inequalities. And we are also speaking about a country with an estimated 5% of population at risk for invasive fungal infection. In this publication, what we aimed was to assess diagnostic capabilities for fungal diseases across the whole country, to evaluate therapeutic access to antifungal agents, and also to identify gaps and guide capacity building strategies. We did this with a national survey, which was ongoing between March and December 2023. The participants were both microbiologists and clinicians. Depending on their profile, they were answering a bit different questions, and the survey was reviewed by national expert institutions. Data were validated and analyzed descriptively. The data we collected were distributed by email and phone, or actually the data collection was done by email and phone with a voluntary participation, and the information collected was based on frequency of invasive fungal infections in the respective institutions, the availability of diagnostic tools, the laboratory workflows and culture methods, and also the access to antifungal drugs and imaging. Here we have a map of Honduras, where we can observe in white dots the sites with answers only from microbiologists, in orange sites with answers only from clinicians, and in green sites with answers from both clinicians and microbiologists. In total, we had 39 laboratories answering the survey and 14 clinical centers. In this slide, we can observe which pathogens were perceived as most relevant by both microbiologists and clinicians. There is a consensus towards Candida species being the most worrisome, and afterwards Aspergillus. And then we have some differences. Cryptococcus, it's equally relevant for around 15% of both microbiologists and clinicians. Histoplasma, it's perceived as more relevant by clinicians than microbiologists. There is somehow a consensus for Fusarium. Sporothrix is perceived as a relevant fungus for around 10-15% of microbiologists, but not by any clinician. And then we have the contrary. Phaeohyphomycetes and Mucorales are perceived as worrisome pathogens mainly by clinicians. In both cases, around 1/4 of the surveyed clinicians. If we move forward, we have this slide regarding diagnostic tools. Almost all the sites have access to microscopy or culture, and a very reduced number of laboratories have access to antigen detection, no access to antibody detection tools or PCR. And regarding the access to antifungals, 50% of the sites have access to at least one formulation of amphotericin B, which is always amphotericin B deoxycholate. 40% access to at least one echinocandin, never micafungin, and all the sites have access to at least one triazole. If we focus on fluconazole, this is the most largely available antifungal, almost in 90% of the sites, and additionally we have around 40-50% of the sites with access to itraconazole and voriconazole, but no access to either posaconazole or isavuconazole. No access either to flucytosine, and around 25% of access to terbinafine. In this research, we identified certain barriers which can be observed in this slide. The first one is the underutilization of microscopy and culture. Even if there is access, not all the institutions make a proper use of it. The virtually absent advanced diagnostics, just to remember, no access to PCRs or to antibody testing. Limited antifungal formulary, reducing treatment options, no national mycology reference laboratory, and lack of mycology training in medical curricula within Honduras. Financial constraints are also described, and low health sector investment. With that, we throw some recommendations in our publication, up to six. The first one, to expand access to rapid antigen and molecular diagnostics. Second, to establish a national medical mycology reference laboratory. Third, to improve distribution of essential antifungals. Fourth, to strengthen reporting system for fungal diseases. Fifth, to enhance the training programs in clinical laboratory mycology. And last but not least, to support public-private partnerships to support diagnostic infrastructure. And with this, we come to the conclusions of this publication, which are four. The first one is that Honduras shows substantial diagnostic and therapeutic gaps for fungal infections. There are limited laboratory infrastructures, and there is restricted antifungal availability, hindering effective invasive fungal infection management. There must be an implementation of a national level policy, investment, and training initiative in a very urgent manner. And the findings of these results and this study reflect challenges served by not only Honduras, but also many low and middle income countries. Thank you very much, and see you next time.